Hi guys, it's Nurse ICURNVUS back with another video from the Browns All Around channel. So the one thing that I think people should know about me is that I am a registered nurse. Yes, I'm a mother of 6. Yes, I am a naturalista. Yes, I have this YouTube channel, but I am a registered nurse by trade. That is the career of choice for me, and I have decided to do some nursing interview questions because nursing is a really sought after career field right now. It's also a career field that is in grave danger of becoming severely short staffed in the very near future. I remember in nursing school and in pre-nursing school hearing about the healthy 2020, 2020 this, 2020 that, where there was going to be such a shortage of nurses that it was just going to be ridiculous. Almost like they didn't know what to do about it. Well, I'm here to tell you that that shortage has gotten very severe, and I think I've been feeling the effects of it for quite some time. I have been a registered nurse for almost 4 years now, but I've been in nursing for 10 years. I started off as a certified nursing assistant to see if I wanted to really be a nurse, see if I liked the surroundings or the environment of being in a healthcare industry. Then I got my licensed practical nursing diploma, and then I went on to get my registered nurse's license. So some of the top commonly asked nursing questions or interview questions. So these are questions that probably may be asked of you even in a nursing interview. I have some of those questions here and I want to answer some of them. This might give you insight on how to answer those questions in a nursing interview, and it also tells a little bit about me being the mother of this channel. So as I said, I'm ICURNVUS, and if you listen to the name, I am trained as an intensive care nurse. I started off in CVICU or CVICCU as a cardiovascular intensive care nurse and coronary care nurse at a hospital in South Carolina where I worked. I have worked pretty much everywhere. I've worked long-term care. I have worked skilled rehab. I've worked rehab nursing. I have worked acute inpatient rehab. I worked med-surg. I worked renal, intermediate care. There's hardly anything I didn't do. I even worked in a prison. I worked on the other side of nursing in the insurance area with Blue Cross Blue Shield for a little over a year. I actually worked from home doing that, and I enjoyed it for a little while, but it got to be really boring, so I had to go back to the floor. And then I never worked in a doctor's office. That's one thing I never did. I don't think I would like a doctor's office. Plus, even though I didn't do it just for the pay, but the pay is not really great in a doctor's office. The hours are good and the holidays off are good, but I just don't think I would like working in a doctor's office. So I'm going to first start off by doing these 5 questions, and then I'll say a little bit more about myself and my nursing career, where it is now, where it's going, and all of those things. So the first question is, why did you decide on a career as a nurse? Well, I always knew that I wanted to work in the healthcare field. I always knew that I wanted to do something that helped people. I just wasn't sure what. I wanted to be a doctor at first. I remember wanting to be an OBGYN when I was really young. I wanted to be a surgeon. I was fascinated with the idea of conception, even at a young age. And that doesn't have anything to do with the fact that I became a mother at a very young age, but I did. I was a mom at 15, so I knew that I always wanted to work in the healthcare field. And I remember my stepmother was a registered nurse. And as a young girl, when I would go and stay with my dad on the weekends, I remember her getting up at the wee hours of the morning and leaving to go to work, and she'd be dressed in her uniform, and we would not see her again until it was dark outside. And I remember thinking, like, where did she go for all this time? I loved her so much and still do, and I used to miss her, but I used to be like, what in the world is she doing for all this time? I know she's going to work, but where is she for all of those hours? And I knew shortly after that she was a registered nurse, but that's where my interest sparked. And she was actually an ICU nurse, and then she transferred to PACU. And then she actually went to the education side where she taught at a vocational school for like 20 some years. And so that's what really sparked my interest as a nurse. I always knew I wanted to be in the healthcare field. I always knew that I wanted to help people. And then my stepmother was a registered nurse. And then I started to look up the career field and everything. And I knew that it was secure. And I knew that they made, good money. And so it was just something that I was interested in. So the first thing I did was become a CNA, because I think that's a really great idea, to do CNA work first to see if you like the atmosphere. Because a common misconception for nurses is that once you become a nurse, you don't have to do that stuff anymore, like cleaning patients and bathing patients and emptying urinals and bedpans. But I think that a good nurse, matter of fact, I know that a good nurse still does those things on a daily basis at my job. I put patients on bedpans. I help patients in the bathroom. I change patients if they need to be changed. I make beds if I need to make beds. And then in the ICU area where I work, we have to, because we don't have healthcare technicians or PCTs or MSTs or CNAs. So we have to do all of that stuff. So that makes a really great nurse. I'm just here to say it. So if you're one of those people that think you don't have to do that stuff anymore, then not to say you won't make a good nurse, but you'll make the job much harder for yourself than what you have to, because your ancillary staff is the people that you depend on. They're your first line. So anyway, the next question is, what do you find rewarding or most rewarding about this job? Hands down, 100% the fact that I help people. Not to say that the job doesn't get stressful. Not to say that sometimes I'm really tired and I don't feel like being bothered. That's with any job. But it is the job that even if I didn't get paid to do it, I would still love to do it. I live in the South, an area that is really hard hit by diseases such as diabetes and strokes and high blood pressure or hypertension, patients who are on dialysis, and I just so happen to work on a renal floor now, and I actually really love nephrology. It kind of goes hand in hand with the heart, nephrology or renal and hypertension or hypertensive medicine. So I have to say that my love is with the heart and the kidneys, but I love patient education. I think that patient education is something that has fallen off over the years. Not to say that everybody has an issue with patient education, but I remember when I was a licensed practical nurse and I would see the nurses, which I don't think I was even supposed to give patient education as an LPN from what I remember. Maybe I'm wrong. But they would just give the patients these stacks of papers to read and give them the prescriptions, and they wouldn't say anything, and they discharge them and they'd send them on their way. And then less than 30 minutes later or 30 days later, you'll see those same patients back in the hospital. And I can remember nurses saying, well, he went home and he didn't do what he was supposed to do, and that's why he ended up back here. And we've got this high readmission rate. And something about hospitals is when a patient is readmitted within 30 days of their last discharge, the hospital has to eat those costs the majority of the time. I know it's something with insurance that says something like that. So I feel like patient education is the area where the ball is being dropped. Not all patients are going to be compliant, but not all patients are non-compliant either. And you have to look at people's intellect and their ability to learn and their education levels when you give patient education. And that's a whole nother video. I'll be doing a lot more nursing videos because it's something I'm really passionate about. But if you send a patient home and you don't tell them anything and you expect them to read all those stacks of papers that sometimes uses medical jargon and sometimes doesn't, they're not going to understand it. They're not going to take the time to read it. I've seen so many instances where patients come back and they're like, oh, well, I didn't know. Or they got a new prescription and we asked them to bring their medicine in and the prescription bottle is still full because they're like, well, nobody told me this or nobody told me that. So definitely the most rewarding thing about my job is being able to help people, and I love doing patient education. So the third question is, how do you deal with someone who isn't satisfied with your patient care? Well, I've got a million stories, but the very first time that a patient told me, well, actually it was a patient's wife, that they did not want me back as their nurse, I remember being so hurt. And now I still get hurt, but not as hurt as I was that first time. I was taking care of a patient. I was working cardiovascular intensive care and coronary care, and I had a patient that was right after he was post-op CABG, so he had a coronary artery bypass graft done, open heart surgery, and his surgeon was a wonderful surgeon who I vied for his acceptance as a cardiovascular intensive care nurse. And the patient had a fairly rough night. It wasn't that rough, but he was very nervous and very scared, and I was trying the best that I could. He was touch and go for a minute. His vital signs were all over the place, and I honestly think like there's nothing that you'll ever be able to do to satisfy some people. And he was an older gentleman, but I think his wife just didn't like me. And so when I came in later that night, the patient didn't want me back. The wife didn't want me back, said that he had a really rough night. And I was so angry and so mad, but hurt at the same time. And I remember a more experienced nurse saying, well, don't worry about it. It happens all the time. But I was really hurt. And that night, the unit was small. You know, an intensive care unit is small. The nurse's station was central. So I saw that patient and his wife all night long. And I was still just as cordial and still spoke to them and didn't have anything ugly to say. It just was what it was, you know, and I got over it. And since then, I think maybe it happened one more time. I don't even remember having a patient not want me back after that. But I have to say that was really hurtful. But, you know, you still have to be professional and do your job. And if they ask for water or ice or whatever, or soda whenever they come out, then you just get it for them and still, yes, ma'am, no, ma'am, yes, sir, no, sir, and just keep on going. So just try not to let it get you down for too long. The next question is, what do you feel is your greatest skill as a nurse? Well, I think I'm a people person. I try to make patients feel really comfortable when they come into the hospital. I always try to put myself in a person's shoes and know that they may not particularly want to be there. They might have issues at home. So I leave all of my home stuff at home and come in with a clean slate and just try to make patients feel as good as possible. I am really keen with my assessment skills. Like, I'm really proud of my assessment skills. So that's probably my greatest skill as a nurse, to be able to assess situations and make the right call thereafter. The last and final question is, how do you handle the stress of the job? That is a tough question. It is very stressful, and it's stressful on more than one level. Like, it's emotionally stressful. It is mentally stressful. It is physically stressful. So usually my time management skills are very good. So I just try to make the best of every night. Like, time management is the best thing that you can have as a nurse. Sometimes you have 6, 7 patients, and you've got to spend adequate enough time with each one of those patients to be able to assess them and sometimes anticipate their needs. And the stress of the job, sometimes I have to center myself. Sometimes I have to count backwards from 10 to 0. Sometimes I have to go and take a break. Sometimes I have to vent. Sometimes I have to go and talk to another nurse, sometimes more experienced, sometimes not. Sometimes I have to go to my director. Sometimes I have to talk to a supervisor. Sometimes I have to call my family. Sometimes I have to call my mom or call one of my kids or call one of my friends and just kind of tell them what's going on so they can tell me just to calm down. There have been a time or two when I've kind of gone off the radar with situations, and I'm never proud of those moments, but we're only human. We have to learn from them. Never get into it with a patient or a patient's family member, and even it's not good practice to get into it with coworkers. Sometimes you just have to learn to agree to disagree, and when a situation becomes stressful, to know how to isolate yourself. Sometimes isolation is a big part of keeping your cool and doing whatever you have to do. Get a soda, get a timeout, whatever. But those are the top 5 of the top questions that can actually come up in interviews. And some of the questions I might have said a little bit too much because this was not necessarily a nursing interview, but interviewing me as a nurse. So Again, that's me as a nurse, and I think that right now I am working on a nephrology unit or working on a renal unit, and I love working there. I would definitely love to get back into intensive care. I actually have a PRN job. Most nurses do, working in an intensive care unit, and I really love it. And it's making me kind of get the Jones in for working a more full time position in an ICU. But I just love the people that I work with where I am right now. The kind of nursing that I do right now is getting more and more geared towards working when I want to. Right now, I work a weekend shift. It's called weekend only work, or WOW, or weekend warriors, whatever you want to call it. Different hospitals call it different things. Where I only work on the weekends, and there's a huge incentive just to work on the weekends, especially at night. And I am a night nurse, so that's what I do right now, and that works for me. So I can have the weekdays off, and I work when I want to during the weekdays, and I work every weekend, and that's just what works for me right now. But anyways, if you are interested in all things nursing, I've got a lot more videos that are coming up as far as nursing care, talking about certified nursing assistants, talking about nursing school, talking about all those nursing school things that people dread, like ATI and HESI and policies and procedures, and I even have like a lot of equipment. I'll be doing nursing education videos, and I'm really super excited about it. Definitely answering questions, definitely open to communicating back and forth with other people who are interested or people who are actually in the field. I actually plan on doing a nursing vlog to the best of my ability coming up soon. I'm super excited about that as well. And if you have any questions, if you have any comments, or even if you have any concerns, feel free to reach out. Make sure you like, comment, and subscribe to the Browns All Around channel so you can see what the ICURNVUS nurse is up to next. Thank you guys.